From the studios of Tucson Business RadioX, recorded in the Stewart Title corporate offices on Broadway, you are now listening to The Mark Bishop Show. And now here's your host, Mark Bishop.
IBM Watson Health recently announced the Fortune IBM Watson Health 2020 100 Top Hospitals and the 15 Top Health Systems Award winners, naming the top performing hospitals and health systems in the U.S. Now, this list recognizes examples of excellence across the country at a time when dedicated hospital clinicians and staff members are working tirelessly to support patients through the COVID-19 crisis. Now, my very special guest on the Mark Bishop Show today is Ekta Punwani, leader, IBM 100 Top Hospitals program. Welcome, Ekta. Lovely to have you.
Thank you so much for having me, Mark.
Well, let's discuss highlights from the list and insights from these high-performing hospitals that may signal new healthcare trends and opportunities for patients, Ekta.
Yes, of course. So, we evaluate these hospitals in a number of areas. We look at clinical outcomes, we look at operations, we look at patient experience, and we look at financial health. And some of the trends that we are seeing in some key metrics is that for the past 5 years, there's been a significant amount of work and improvement in the patient experience measure. So we already expect, when we go to a hospital or when we have a family member or loved one in a hospital, we expect that they're getting quality and safe care. But what we love to see is the patient experience. They're being treated respectfully, they're being treated in a caring manner where they feel safe. And so many organizations are really focusing on that. So that truly is a good trend that I think we want to hear about. The other trend that I'm seeing is that it's more of a clinical term. It's 30-day readmission rates. And what that really means is when you leave a hospital, you don't want to have to come back because of a complication or infection. So organizations, hospitals, nurses, caregivers, social workers are doing a much better job of transitioning patients to their home or their next where they're going to be staying after the hospital stay, to make sure that they are staying well and recovering and not getting, back admitted to the hospital. So those are two of the key trends that I see.
Well, for over 25 years now, the 100 Top Hospitals program has shined a light on the nation's highest performing hospitals and health systems. And this helps to identify top performers too and deliver insights that may help all healthcare organizations deliver the highest quality care. Ekta, what are you exactly finding now? What's standing out?
One of the things that I believe are more and more hospitals are looking for data. They want to make data-driven decisions. They want to see how they are performing, and they are building the infrastructure to use analytics to help them drive that performance. And so that's what I get really excited about. I think IBM Watson Health wants to continue to support these organizations to help support in their improvement journey so that we can improve the industry as a whole in this country.
Well, as I'm to understand it, and correct me if I'm wrong, in addition to the widely recognized national hospital networks and teaching hospitals, the list also includes small, rural community hospitals that have demonstrated an unwavering commitment to innovation and patient-centered care.
I'm glad you brought that up. I think what's really important for all of us to know is that quality of care is not dictated by the size of a hospital. We have a number of high-performing hospitals, not only across the country, but in your neighborhood. They could be small community hospitals, but have excellent care and are safe and providing a strong patient experience.
So why does IBM release a list of leading hospitals and health systems?
First of all, we definitely want to, celebrate and recognize these high-performing organizations. They have truly created the fundamentals of what it means to deliver high-quality outcomes to their communities. But the next piece is, how do we take the data and how do we take the insights and the learnings and how do we apply it to all the other hospitals in the country so that we can improve healthcare?
So what factors do you consider when you compile these annual rankings?
Yeah, so we're looking at 11 indicators when we rank our hospitals, and they are in the groups of, if you will, clinical quality outcomes, so the typical things that we like to look at. But we also look at operational efficiencies, patient experience, and financial health.
So do you see trends, while you're creating the list?
We do. We see trends. Overall, we see trends across the country, whether it's certain regions are more focused on improvement. We see trends in specific metrics. Like I mentioned before, patient experience and readmission rates are two of the key measures that we've seen a huge improvement in over the last 5 years. So that's what's really exciting, that we're able to see progress of the industry.
So obviously then how can hospitals use this particular list to better serve patients overall, do you think?
So IBM Watson Health wants to continue to partner with hospitals and health systems. So, the list is what I say is like the tip of the iceberg. There's numerous data that sits behind this. And so we partner with hospitals and health systems to better understand that data, to provide insights, and we support them in their projects and their improvements that are going on within their organization.
So is this something my listeners can look up and read more about if they wanted to?
Absolutely. So listeners can go to ibm.com/Watson Health. You can look at the study that was published. It's a summary of the findings of this list, the trends that we've been talking about, and you can even get more information on healthcare insights.
Okay. Well, that's because it is interesting. It's different. And I think patients would like to, listeners would like to think, somebody really does care out there and what's going on. I mean, it's hard for everybody. You actually serve on the Health Analytics Advisory Board for Northwestern University in Chicago. Is that correct?
I do. This is my IBM Watson Health is my day job, and I really am very passionate about healthcare analytics and how we can use it to drive improvement. And so have decided to teach a course at Northwestern University around this topic, and I sit on the board to help advise and guide the direction of that.
Well, you received both a Bachelor of Science and a Bachelor of Arts degree from the University of Illinois and a Master's degree in Health Administration from Washington University in St. Louis. Tell me what the MHAM letters are, S, after your name. What does that stand for?
The MHA is the Master's in Health Administration. Is that what you're referring to?
Yeah, just I hadn't seen it before.
Yeah.
Huh? Okay.
Yeah, it's just a master's program that really, so instead of an MBA, it's more focused around healthcare and the operations and strategy in healthcare.
Well, this IBM Watson Health thing is terrific. We've had a few interviews with, IBM and diversified divisions, and Watson's bobbing the head up more and more now, becoming a very integral part, Yourself, you've demonstrated building performance improvement and analytics capability. You must like maths, I tell you, with multiple healthcare organizations, including Adventist Midwest Health, Advocate Healthcare, and Northwestern Medicine. And you have served on the board of examiners for the National Baldrige Performance Excellence Program for 4 years. So there you go. And what's this? An international certified black belt. Why do you need that? Tell me. So Mark, that is, whenever I tell my family and friends about that, they're like, what do you mean? This is a very industry known practice. So when we talk about performance improvement and what industrial engineers do, and that is really how do we improve processes across large systems. That's what that's about. Oh. So I won't get into the technical, but I've worked in hospitals and health systems for 20 years. And a big part when I was starting off was how do we design the right way to do things to take care of our patients, but also for clinicians. How do we help them be more effective
And so they're spending more time with our patients thinking about the things that we want them to think about, not thinking about all the administrative tasks.
Very good. Well, you're very good at what you do, and thank you for what you do. It helps a lot of people. Ladies and gentlemen, Ekta Punwani, she's the leader of IBM 100 Top Hospitals program. Thanks for all you do, Ekta.
Thank you so much, Mark. Take care.
Yes, you too. Goodbye now.
Bye-bye.